So we have discussed the estrogen receptor type of cancer, the HER2 type of cancer, and then there is what's referred to in an acronym as TNBC. Can you tell me what TNBC is?
TNBC is triple negative breast cancer, and it occurs in roughly 15% of women.
15,
give or take.
and these are the ones that you've mentioned is your company is targeting specifically.
That's what we're most interested in, and the reason we're most interested in it is that it is really our biggest challenge right now, I think, therapeutically. And the reason it's our biggest challenge is that the specialized therapies, or what we call targeted therapies, haven't really been advanced or haven't been developed for triple negative breast cancer like they have been for the other breast cancer types.
Why do you think that is?
I think it has a lot to do with the understanding of what actually drives that cancer. Those genes are different. They're actually unique and different to what drives hormone positive breast cancer typically.
Is there a certain risk factor that makes women particularly targeted with this type of cancer? And by the way, I don't care what it is, we're not going to scare you, because we need to have the courage to look at this stuff and do what we need to do as women to face it. So we want to build that
100%.
confidence into women.
So there's a lot about triple negative breast cancer that needs to be known. So first of all, it tends to happen in younger women.
Interesting.
Yeah, and so then you might be thinking,
What would be
well,
your age range? when you
okay,
say
so
younger women?
as young as 20.
Do not be afraid.
Do not be afraid. No, seriously. As young as 20, up to say mid-range of say 50. And so the reason that this is so surprising, and certainly when I started my research into this, I thought it can't be possible. It can't be possible. I think a lot of people think, oh, it couldn't happen to me, right?
Right.
Can't, because I'm too young.
Mm-hmm.
What you and I probably often think of is, oh, well, you can go for screening with mammography.
Mm-hmm.
Well, here's the thing. Young women in their 20s and 30s and even 40s, your doctor will never tell you to go for a mammogram because you're too young.
Right.
Right?
Why would we think about that?
There's another reason. The other reason is that the breast is very dense, and it's very difficult for the machine to actually see through the breast and to pick up those.
Oh, so when it's slamming you like a pancake,
Yes.
and it's stretching you, slamming you, and you feel like your life is being ripped off your chest,
Yes.
they still can't see into
It's
the...
very hard.
There's still not diagnostic equipment that is a little bit better at looking at soft tissue?
It's improving,
Mhm.
and I would definitely put a plug out there to continue to make improvements in that. So the early detection is one of the things that's really hard for TNBC because it does occur in younger women. So there's that. Other factors that contribute. 14% of women that are diagnosed with triple negative breast cancer carry what's called the BRCA gene.
BRCA?
BRCA. So it's breast cancer susceptibility gene.
Oh, interesting.
And you probably have heard a lot about it, maybe on the news, maybe celebrities.
From celebrities?
Yes.
So a certain celebrity that we know that had her breasts removed because she had that
Yeah.
particular...
She knew she had the gene. So she
I
knew-
would do it.
Yeah, I would too.
I would. I'm sorry, but I would take them off.
Yeah.
If that's,
Yeah.
yeah.
And I mean,
would.
to I think worry and always have that hanging over you.
Mhm.
I think it's really important that you take control of your body.
So can I just ask you about that in particular? So if it's a breast cancer driven concern and then you have your breast removed, can that possibly grow in any other tissue in your body?
it can also contribute to ovarian cancer.
Interesting.
Right.
So
So it's only those two cancers. So
Really?
you can have that gene in every cell in your body, but it only comes forward in breast cancer and ovarian cancer.
interesting.
Nobody knows. I don't think we really know why that is. But here's the thing. If you know you have a family history of breast cancer, it's good to be more vigilant about screening. Don't put it off.
Right.
Absolutely do not put it off. The other thing is that, and this is the flip side of it, 95% of breast cancers do not have the hereditary gene. Do
Really?
not. Right.
Wow.
Right. So
So
you
you're
can't blame it
not-
on yourself and say, well, I didn't go for genetic testing, or I didn't do this or that.
And you're not worried that your children are also gonna be targeted
Right.
as females automatically. You're just like,
No,
you're not gonna put that fear into
No,
them.
and even in families, and I have friends who have have had breast cancer and have the BRCA gene, doesn't necessarily mean your daughters will get it. They should be tested.
Right.
So you can even have one child with it, one without, or maybe neither get it. So that is, I think the main thing is just be informed, be informed, be proactive, ask questions. And if you're not getting the answers, keep asking questions.
Yeah. Yeah, and and pursue that. Well, women have, and men too, but in fairness, we're talking about women.
Yeah.
Women have taken a significant charge over their health.
Absolutely.
They really have not left their health in the hands of other people anymore.
No.
And so for them to take that really informed step of getting tested, when you talk about getting tested for that gene, how would if I wanted to be tested for that, what would be the first thing that I would do?
I would talk to my family doctor, and I would describe the history. If you have any, obviously your family history would be the first sign that it's a good idea to be tested.
Right.
A couple of other things. So that gene, the mutations in that gene tend to run in women who have from Ashkenazi Jewish ancestry.
Really?
Yeah, and so that alone, just your heritage is important.
That's
one
where
thing
ancestry comes in.
That's right. That's right. Another thing that I didn't know until recently is that next to Jewish women, Hispanic women tend to carry this.
Seriously?
I didn't know that either. So I recently just learned that. So
So
again,
you Hispanic women,
go get
you
tested.
feel free to get yourself tested and find out how you need to get yourself tested.
Absolutely, talk to your doctor.
Yeah, so we'll do that on our next segment. We'll talk about some of the options for testing. Although we're not experts in it, we'll at least give you some suggestions on our next segment.